Welcome to TheraPlace Family of Companies webinar. Today we'll be discussing concussion, the impact of the psychological and the cognitive factors. Today we are joined by Dr. Stephen Russo, PhD. He's a clinical sports psychologist and the director of the Concussion Management Center at Springfield Psychological. I am Sandra Wild-Sutton. I'm an occupational therapist and senior educational coordinator for TheraPlay. If you would like to ask us any questions throughout the webinar, please just type in your question and we'll make sure that we answer them at the end. It's better that you type in as you go because there is a little bit of lag if you wait until the end to type things in, and we want to make sure that we get to all of your questions. Okay, so let's get ourselves started. All right, so what is a concussion? A concussion is a metabolic and physiological injury, and it occurs in the brain from a direct or an indirect force. And it usually, it of course happens to the head, and it can disrupt normal functioning. It can be caused from direct forces, such as falling or a blow to the head, or as well as an indirect force, such as a whiplash, an acceleration or decelerations type of injuries. The diagnosis is based on a collection of your symptoms, the neurological impairments, and the mechanism of the injury. And while there are no psychological damages done to the brain, a concussion causes a metabolic crisis, and that can result in your decreased function. Concussion is used along with the term mild traumatic brain injury because of the recent research showing that long-term neurological effects. Imaging can be done to rule in or out a more serious pathology, such as an intracranial hemorrhage. However, the extent of the concussion cannot be determined from these scans. Previously, return to sport took place once initial symptoms had resolved. However, it's now known that multiple incidents within a short period can lead to serious injury or death. Post-concussion symptoms can be seen in a lot of different ways. Possibly you'll have a period of insomnia, which is a lack of sleep or have trouble getting to sleep or staying asleep. Somebody may have some cervical spine injury and pain to that cervical spine. We may see some cognitive fatigue or what we call executive functioning impairments. These can include things like memory, time management, the ability to plan and organize, and we'll go into that a little bit later. You may see some ocular changes or things that are going to impact your vision, and many times these are the things that can impact kids at school. You may see migraines and headaches. There are psychological factors, which we're going to talk about today. And then there are things that are called vestibular balance and dizziness factors. The vestibular system is actually located inside your ear, and there is fluid that moves through those semicircular canals, and that fluid helps us know where our head is in space and how fast or slow we're moving. An easy example of the vestibular system is if you're sitting in a car and you happen to see out of the corner of your eye the car next to you move, and you felt like you moved yourself, and you end up slamming on the brake, and then you realize that you didn't move at all. And so that's your vestibular system playing a little trick on you. Your body felt like it was moving even though it did not move. And that vestibular system really impacts our ability to maintain our balance. And it can also give us symptoms that cause that dizziness. And as a whole, we are going to treat those symptoms. Okay, we're going to turn over the presentation this time to Dr. Russo, and he will start with some of our psychological concerns.
Great, thank you, Sanjay. And let me start with just talking about that as a psychologist who's managed concussions for over a decade at this point. I look at this injury from the same perspective that I look at other sports injuries, and that's essentially the argument that I'm going to make in this presentation today. Is that historically we have treated concussion as if it is somehow different than any other sports-related injury. And when you talk about sports-related injuries, we always have looked at the psychological aspects of the recovery, having a positive attitude, having the desire to recover, having confidence in the treatment providers. These are all, from a historical perspective, we've known that these are important factors to recovery because injury is an unexpected event at the end of the day. So I'm going to try and put concussion back into the context of a sports-related injury, because some of the recent research on concussion is showing that psychological factors are playing a role in the recovery from concussion. And we'll talk about some of that research a little bit later on in the presentation. This first slide is really demonstrating that concussion, even though we tend to have a lot of fear or worry about concussion, and I think if you ask people nowadays what are they most concerned about, in terms of sport participation via injury, concussion is always one of the things that pops up. But if you look at the actual statistics in the number of sports injuries that occur, the kinds of sports injuries, locations, concussion is always on the lower end of things. I don't hear a lot of people talking about not playing football because they're afraid of ACL injuries or ankle sprains or breaking bones and things like that. But yet we do have a lot of people that are now talking about not playing sports, or not playing certain sports because of fear of concussion. And so what we have then is we are treating this injury as if it's somehow different, or somehow it's fundamentally separate from other injuries. And yes, it is a brain injury. I'm not trying to minimize that component of it. And as your brain controls the whole part of your body, including emotional regulation, that's an important factor. But at the end of the day, we have a lot of anxiety, we have a lot of fear around this injury that we now know is playing a role in people's recovery. So the statistics that I'm showing you on this first slide here in 2012 statistics, which is basically the most recent statistics we have on injury, you have a lot of injuries. And so injury is part of sports. And so concussion is a percentage of all injuries that are going to occur in sports. And so if you're signing up for participation in sports, you're signing up for the risk of any kind of injury, whether that's a broken finger or a dislocated knee or a concussion. And so what we have then is we have people that are playing sports, and I'm trying to move to the next slide, see if this works for me. Right. Can we slide that one down, Sandy? There we go. Okay, so when we look at the psychological aspects, and again, this is more from a sports medicine perspective, and we look at all recovery, these factors that are on this slide here, we know are important factors associated with concussion. I'm just going to kind of go around the wheel, so to speak, from a clock perspective, from top to bottom. Mood and emotions. We know that people who play sports, and again, I'm speaking about concussion from a sports-related perspective. That's my background in sports-related concussion and sports psychology, and my understanding of it from that perspective. But when we look at anybody who gets injured in sports, there is almost always an emotional reaction to that injury. The timing of the season, the type of injury, whether we're talking about a physical injury or a concussion, there's almost always an emotional reaction at the early parts of that injury process. And we're seeing the same research and the same results in concussion, in that people are more emotional, more sort of frustrated, whether you want to call it anxious or depressed, or those kinds of feelings at the initial part. As we move down around the clock, motivation, trust in treatment, self-efficacy, the idea that you have to want to get back, you have to believe in the treatment providers. You have to be confident that you can return. These, again, are psychological challenges for any injury. We know that that's a big part of concussion, the idea of trusting the recommendations that you're getting from treatment providers, the desire to go back. I see a lot of people who have crises of motivation and confidence when it comes to concussion, particularly like, look, I don't want to go through this again. I don't want to have to deal with this again. I don't know if I really want to go back to sports or go back to contact sports as a result of this injury. And so, whether we're talking about knee injuries or ankle sprains or concussion, the idea that you have to have a desire or a motivation and confidence in yourself as well as your treatment providers to get better. Athletic identity is an interesting one, and we'll talk a little bit about that later on in another slide. And it works in the opposite direction than many people think. The people that have an athletic identity, the concept is that they truly see themselves as an athlete, and so it's part of their sort of their self-structure, their psyche. It is sort of how they define themselves. Ironically, people with a higher athletic identity actually struggle when it comes to any kind of injury. We've known this for a while in the sports medicine world with musculoskeletal injuries. The idea is that if you're putting all of your sort of future and your energy and your direction into being an athlete, and now you're injured and you're prevented from being able to participate in athletics. It really is a struggle from an athletic definition perspective. Who am I? What does this mean about me as a person, that I can't participate in something that defines me? And we're seeing the same thing play out in concussion. Some recent research, again, which I'll show and talk about later, is that this athletic identity kind of works against athletes when they get hurt. Social support, cognitions, to just finish out the wheel. There's a lot of research, not just in concussion, but also in injury and health psychology, talking about social support being one of the best predictors of outcome. And so whether you're talking about a traumatic injury of a musculoskeletal perspective, or whether you're talking about concussion, the idea of having a support network around you is crucially important. And then the idea of how you think about your injury, and the thoughts that you put into it, the way you analyze it, or the way you understand your injury. And that may be defined by sort of time in the season or the severity of the injury. All of these things factor into the ultimate outcome. And that's really what I want people to understand, is that this still plays a role in concussion, even though it's really only been in the last 2 or 3 years that this has been really researched. Ironically, myself, Anthony Contos, and Mickey Collins out of UPMC, which is where I was back in the early 2000s, we wrote an article about this back in 2004, describing the psychological response for sports psychologists in concussion, walking sports psychologists through concussion management. And it's really almost been a non-topic in the world of sports psychology until the last 2 or 3 years. And so we'll see later on what the research is showing. This next slide is really basically talking about the current way of managing concussions. We manage concussions now completely differently than we did 10 years ago, 15 years ago. This idea of cocooning and resting and putting people in dark rooms and having them not engage in activities, that's very old school, if you will. That's not something that is currently recommended, particularly if you have ocular and vestibular issues, particularly if you have anxiety. A person that is generally anxious before a concussion, the concussion's not going to make them less anxious, and putting them in a dark room and having them do nothing all day and taking away electronics is only going to make them ruminate about their symptoms, fixate on symptoms. And so we manage concussions based on the categories completely differently. The way that a cognitive fatiguing concussion is managed versus a cervical spine concussion. And that's really the idea, is that if we have a good understanding of what kind or typology of concussion you're having, we can individualize a treatment plan. The factors you see on the right are historically the research on concussions and what plays a role in longer recoveries, slower recoveries, number of concussions, migraine history, age, and so on. The ones at the bottom are the ones that are being really sort of more recently looked at, that a person's physical or psychological functioning prior to the injury may have an influence on their eventual recovery. Well, if you've been in sports medicine in the last 20 or 30 years, you know that that's been true of any musculoskeletal injury to date. So secondary gain issues, litigation, the idea that people have work-related injuries that don't enjoy their job and then have lawsuits and things, that's going to affect their recovery. Again, we've known that from a musculoskeletal perspective for a long time. We're just finally applying these concepts into the world of concussion. And so at the end of the day, what is an injury? Any injury that happens, whether it's concussion or musculoskeletal injuries, is going to be a psychological challenge to most athletes. Emotional reactions are pretty common, and fear of re-injury, fear of missing out, fear of getting replaced in the lineup, all of those things play out whether we're talking about a concussion or whether we're talking about a quad strain or anything along those lines. And so the idea that athletes who get concussions are somehow different than other athletes who have musculoskeletal injuries, again, the research isn't supporting that. And what it's showing is that in addition to the normal emotional reactions after an injury, you're also talking about a brain injury, which is involved in regulating emotions. And so people tend to be more sensitive, more emotional, sometimes even more irrational, irritable after a concussion. And so on top of the normal psychological reactions to any injury, you also have the added challenge of regulating emotions, which is done usually by brain function. And so it becomes a problem when you start talking about managing this injury. The left side or the right side of this slide is what I was speaking to earlier when we start talking about athletic identity. And so when you look at athletes who suffer injuries, who has the greatest emotional reactions, the emotional difficulties after the injury? Athletes who generally are more invested in playing professional sports or playing high levels of sports, who identify themselves as an athlete and rarely have activities or interests outside of sports. I want you to remember this when we start talking about what's happening in the world of sports nowadays with sports specialization and with the idea that athletes are playing their sport year round, because essentially we are creating a situation where we're increasing athletic identity through sports specialization. We're creating situations with that concept that actually makes athletes more emotional, more frustrated, have less inclination or less resiliency when it comes to getting an injury. And so this whole idea of who has the most emotional difficulty after an injury is this athletic identity where people are really invested in being an athlete. And so, again, if we're talking about who recovers and the emotional reactions of people after an injury, why is it important when you're trying to track emotional symptoms? Because at the end of the day, it has a direct bearing on outcome. Athletes who are demoralized, athletes who are distressed, depressed, anxious, tend not to follow along with instructions from their care providers. They don't adhere to rehabilitation programs in general. They don't have confidence in a recovery, don't believe that they're going to get back to their sport. All of those things affect, do they stick with their rehab program? Are they compliant with their recovery process? And that's why you have to pay attention to the emotional reactivity and the emotional status of someone who's injured. Athletes who are reluctant to share their emotions are at risk, because what we don't want to see is athletes shutting down, internalizing, and separating, socially isolating after an injury. So again, we need to kind of pay attention to emotions. We haven't spent a lot of time in the concussion world talking about it, but in the world of injury and sports medicine, we've been talking about this for a very, very long time. All right. You have to want to get better. You have to be motivated. You have to have that positive outlook. You have to believe that you're going to recover. All of that is a fundamental part of all injury recovery. And we just need to start applying these concepts into the concussion space as well. Social support from personal life or social support from your sporting life is hugely important when it comes to recovery. And when you start talking about chronic pain, and the equivalent I'm going to give you in the concussion space is post-concussion syndrome, right, a chronic pain condition that involves psychological factors. Any chronic pain condition that involves psychological factors involves this concept of catastrophizing. And I'm going to focus on the middle section here, where if you're talking about emotional difficulties and tolerance of pain, the three pieces in the middle of this slide are really the things that I want you to understand as athletes who tend to ruminate or fixate on pain, athletes who tend to magnify the value of pain, and athletes who feel helpless to control their outcomes. These are the athletes that tend to get into an emotional space that leads to chronic pain. Well, if you think about historically the way concussion is managed, we take phones away from kids, we put them in dark rooms, we tell them they're not allowed to engage in activity. So what do? They sit around all day thinking about how they feel. We've now created a situation where they're ruminating about their pain. We've provided lots of education over the last 2 decades about the importance of concussion management. We've frankly scared some people when it comes to brain injury and concussive injuries, that now every time that they have a headache after a concussion, they establish a significant negative meaning to it. That my headache means that my concussion is really getting worse, therefore I'm really having problems. Now I'm sitting around thinking about whether I have a headache all day, and I'm worried that it means that my brain is permanently damaged. And oh, by the way, I'm not allowed to do anything because I need to be cleared. I need to have approval by physicians to get back out in the field because of some of the state laws around concussion where you have to have formal clearance. Some states are different than others that are very specific about their clearance. And so the historic management of concussion has in essence created a chronic pain condition because we're putting people in situations where they ruminate, fixate, magnify, and feel helpless about their recovery. And so when we have people that are doing this for long periods of time, it leads into a psychological pattern that over the long haul can create problems for you. And then if we take this whole concept into what is happening in the world of sports nowadays, it will have a little bit of an added meaning to you. there's a larger percentage of athletes nowadays that are playing sports solely for the purpose of getting to some destination, whether it's getting a college scholarship or playing professional sports or, using athletics to sort of increase your standing or your status in your life. That is a fundamental change that's probably happened over the last 15 to 20 years in the world of sports. The concept of sport specialization, that I'm going to play one sport all year round. I'm not going to take any breaks, and I'm not going to switch sports depending on the fall or the spring or the summer. Right? We have created a situation where this is the way that we progress in sports. So, I'm going to play sports at 10 years old, and I'm going to play baseball all year round, and I'm going to get a college scholarship for baseball. And, oh, by the way, I'm still 10, but I'm thinking about where I'm going to be 8 years from now. And if I don't specialize, then my chances are diminished. We see this concept of specialization sort of bleeding into other areas, music, art, and so on. And we see lots of people spending a lot of time, a lot of money, a lot of their energy in this idea of playing sports to get to somewhere else. And so this idea of sports specialization, yes, I could talk all day long about sports specialization from an injury perspective, but I want you to think about it from a psychological perspective. If you're spending all day long or all year long, all week, all summer, whatever it is, playing a certain sport, your athletic identity is now wrapped up with that sport. And so I get a concussion or I get a knee injury. Now the very factor that is part of my training every week is now working against me, because now psychologically I can't handle not being a part of my sport. And so sports specialization, yes, it increases the exposure to injuries, and we have overtraining injuries and overuse injuries, but psychologically it's also creating a situation where athletes truly define themselves by the sport that they play. And that in and of itself creates a risk factor when they get hurt. This is an NCAA study that came out in 2015 that looked at the expectations that athletes have at the age of 12. And so the question that was put to all Division 1, 2, 3 athletes was, what kind of expectations did your family have about you with your sport? And so this is just the sport in football, but I could put the same slides up for basketball or softball or soccer. It is the same pattern that if you go from left to right, you're talking about Division 1, what we used to call the Division 1 AA, Division 2, and Division 3 sports. And so within the sport of football, you have significant proportions of athletes that have expectations that they will play college sports or they will get to the professional levels at the earliest age of 12. All right. So this is an example of what I'm talking about, that athletes have this expectation of getting to somewhere else through their sport. Now, from my perspective, that all that's doing from a psychological perspective is putting more pressure and putting more expectation, putting more stress and anxiety from a psychological perspective on the athlete that's participating. And so we have sports specialization, we have expectations for advancement in the sport, right? And then on top of that, we have athletes that are frankly stressed. Whether you're a student athlete at the high school level or a student athlete at the college level, the experience of the time demands, the stress demands, the physical demands can be overwhelming, and no one in this generation appears to be sleeping appropriately, right? The research, again, from the NCAA is looking at that 48% of male athletes, 43% of female athletes do not feel rested half of the mornings during a week. But if you compare that to their peers, 45 and 39%, it appears that nobody in the college age or is sleeping in enough hours to justify their activity. Athletes need more sleep than their peers, not less. And so what happens is athletes are trained from an early age to push through symptoms, push through difficulty, keep working, keep grinding. And then when it comes down to the psychological aspects of all of this stuff, they wait until they're literally falling apart before they ask for help. And so compared to their peers, they're more stressed. When they finally come in for counseling, they're experiencing more difficulties. They have higher rates of anxiety and depression compared to their peers. And then on top of that, they don't sleep. So there's no recuperative, restorative sort of aspects to their day-to-day life. This is the life of an athlete, okay? And so the life of an athlete who then gets hurt is a completely different conversation. All right, let's take it into a different perspective. Let's look at what's happening, from a cultural perspective. What's happening to adolescents, kids adolescent kids, young adults, what's happening in their world. The kids that are coming of age now are have been raised in a very unique environment where we can talk about school shootings and we can talk about financial insecurities, a severe recession over the last 10 years, right? They're hitting puberty at a time when technology and social media are really changing the way people interact. And we're talking about a group of people that really don't see a difference between the real world and the online world. In the adolescent world, they're the same. And so we can talk about online bullying and technology and Lord knows if I had to deal with Twitter and Snapchat and all these kinds of things when I was a kid, I probably wouldn't have made it to college, right? Because these are things that just go through, a kid's life that add more pressure, more stress. And that's what we have seen in the last 6-7 years. We've seen anxiety and depression rates escalating for adolescents at a rate that we haven't seen before, cutting across all demographics, affecting people whether they go to college or not. All right, if we want to add the idea of financial insecurity into that, we're talking about significant increases in anxiety and depression in this generation of athletes who are playing sports. And again, some of the research showing that females are more at risk than males. Taken along this line, the number is 1 in 5 for men, almost 1 in 3 for girls or women. You're also talking about, if you combine the two, 1 in 4. So the idea that 25% of adolescents, regardless of whether you're talking about female or male, is having some level of anxiety or stress that is debilitating at some level. Lots of kids having depression, lots of kids going on medication at a rate that we haven't seen in previous generations. And so if you look at concussion and sports injuries in this context, you have a very fragile individual or we could talk about it generationally. We could have a group of individuals that have more pressure, more expectation than other generations, and now they have to learn how to deal with injury when they have been pushed to use athletics and athletics endeavors as a way of advancing their position. And so that's what you're starting to see over the last 2 or 3 years is people are starting to look at the psychological aspect of concussion. And frankly, they're finding that it plays a lot of a role that has not really been well understood in the recovery from concussion. And so Turner and his group in 2017 looked at the psychological responses between concussed individuals and concussive injuries and musculoskeletal injuries within an athletic group, right? And both of them sort of showed the same gradual improvement in their anxiety and mood states throughout the recovery process. And then when they looked at the psychological factors, particularly in the world of concussion, it was psych factors that played a larger role in their recovery than physiological factors. So being socially isolated, being separated from their team, not being able to engage in activities of daily living, time lost from practice, time lost from games. Athletes are identifying this as a primary factor involved in their recovery. And so if we think about concussion and the research on just what are concussion symptoms like, they're horrible for the first 7-10 days. The first 2 weeks for a lot of people is really difficult. But typically, concussion symptoms are resolving within a month of the post-injury process. And you're expecting to see the same thing psychologically. Anxiety, depression, distress, all of that stuff should be getting better in the second, third week. If it's not, then that's a red flag for the management process. And sometimes what we do that helps concussion can actually backfire on us and create psychological problems down the road. And so in addition to the regular injury issues we have athletes that walk around that look, quote unquote, look fine, don't appear to be injured. And so it's different than an athlete who breaks their leg and has a cast and that they can't play. The concussed athlete, not only are we talking about a brain injury which interferes with their ability to regulate emotions or make sense of things, but they look fine, which then creates a whole nother psychological challenge where they have to explain themselves. And well, this is what's really happening to me, and I have to make excuses why they can't play, and they feel pressure, from teammates and coaches sometimes to get back on the field because of the way they appear. And so there is definitely a psychological challenge when you start looking at athletes who suffer from concussions. And when you start talking about other studies that have looked at this, once again, this higher athletic identity, motivation, and anxiety keeps coming up. So O'Rourke and their group, 2017, again, recent studies have looked at athletes who took less than 14 days, 14 to 21 days, 21 to 28 days to recover. And a large chunk of the symptom change over time was related to their athletic identity, whether or not they wanted to get better, that A motivation. So the athletes who have higher levels of, I don't want to go back, they have trouble with symptoms. And then athletes who have higher levels of performance anxiety or stress about their athletics. All right, social support systems, great. High mastery, low ego coaches. Put that in another way: supportive, nurturing coaches and large social networks tend to facilitate recovery from concussion. The last point that I'm going to make on this slide is the flip side of it from a parent perspective: low mastery, high ego. These are parents that tend to put a lot of pressure on kids to get back to play their sports. That was also associated with symptom reductions. My suspicion on that is that's more about athletes hiding their symptoms because their parents want to get them back out on the field. So again, a good third, close to a quarter to a third of the symptom change attributed to psychological factors, not physiological or neurological symptoms associated with this injury. So it's time we start thinking about concussion in the same way that we've looked at other injuries around sports, musculoskeletal injuries. There's a different challenge, obviously, between the observable, non-observable factors in concussion versus musculoskeletal injuries. Right? But there is this psychological component to it. How often are you worried about your symptoms? How often are you thinking about whether you have a headache? Are you not seeing your friends, not doing things that you're clear to do? Are you really worried about your eventual recovery? These are questions that you have to start asking people about their injury and about their concussion. And a lot of the research, and some of it is very old research, has shown that just talking to people, educating them about concussions, explaining things in a non-threatening way, not over-exaggerating their risk factors or the things that might happen to them, these all can go a long way to help people to recover. The behavioral aspects of concussion have not been addressed adequately, in my opinion. We still rest people too long. We still are allowing people to take naps after school when they shouldn't be. We're still not having people exercising effectively, even though a lot of the research is showing that light, low-grade physical exertion actually helps recovery with concussion. And so there are behavioral factors and psychological factors that you need to pay attention to when you're managing this injury. And so this idea of prescribing prolonged strict rest, there's several research studies out there that are showing that it doesn't benefit the athlete. From my perspective, now you're talking about psychological factors, it actually boomerangs on you and it actually creates problems because you're talking about social isolation and being prevented from engaging in activities that you enjoy. Physical activity and avoidance of physical activity is a very difficult, slippery slope sometimes. It's very common for athletes to experience an increase in concussion symptoms after they start going back to activity. That doesn't mean that their injury is worsening. It just means that their activity level is increasing, and it takes a while for their body to adjust to those things. If they start putting meaning onto that and they start worrying about that, then that's something that has to be addressed directly. But the idea that you're having a normal, regular elevation in activity, so you're having a normal, regular elevation in headache and things like that. So the idea that you need to persist and push through symptoms, again, hopefully that you have a good understanding of this athlete and where they've come from, but the idea that you can push through concussion symptoms in a sort of controlled way is a conversation that needs to happen more around this injury, not less. And so the idea of physical activity and the positive aspects of physical activity versus avoidance and kids that don't want to go back to school for fear of exacerbating their concussion. And once that pattern begins, now you've created a whole different kind of problem psychologically. Or the athlete that has an underlying ocular or vestibular issue that is then falling asleep after school or not getting the appropriate treatment, then can't sleep at night, and now is attributing their sleeplessness at night to concussion and making it more sort of dramatic than it needs to be. Coping and the idea of actively coping. I don't know one medical condition where passive coping works, whether you're talking about just burying your head in the sand and hoping it gets better. Well, if you think about it, that's the way we've managed concussion historically over the years. We've done a very passive approach We've told people to do less, not more. Right. And so what we have now is we have to shift that conversation. We have to engage in active recovery responses. And so that's where reassuring people, talking about people, yeah, this is concussion. It's no big deal. It's going to go away. It's a temporary injury. You're going to recover from this. You're going to be fine. Sometimes just saying that to an athlete or an individual can do a world of good of taking some of the stress and some of the anxiety away. So we need to educate better. We need to be more active. We need to be involved with regulating behaviors when it comes to concussion management. And so that might mean that we let people do things in a smaller basis as they start to recover. So, okay, go on your phone for 5 or 10 minutes if you need to connect with your friends. Just get off the phone after 15 or 20 minutes. So now that your anxiety level is lower, and so that you can kind of stick with the recovery plan. Go for a walk instead of taking a nap. The idea that we could be actively engaged in things that's not going to hurt us, that's going to help us promote recovery. And so again, I'm advocating that people understand the seesaw or the balance effect here, that what you're doing for concussion management may be boomeranging, later on after the person is in the middle of this recovery, and you may need to actively treat that person from a psychotherapeutic perspective. And what does that look like? That looks like chronic pain management. We teach people alternatives. We teach people to control their thoughts. We teach people not to over fixate on symptoms, to disengage from symptoms. We teach them to do what they can, modify, adapt, and we teach relaxation and coping strategies so that people can control their emotional responses to injury. And so that's very much out of the world of sports medicine and musculoskeletal injuries from the mid-90s, from the early 90s, where we were really looking at chronic pain as a psychological issue and a bi-directional issue with physical discomfort and depression and anxiety. It's the same concept with concussion. It just gets applied in a little bit of a different way. So I'm going to turn this back over to Sandy at this point and let her take it from the rest of the way through, and then happy to answer questions for people at the end.
Great. Thank you so much, Dr. Russo. So with all this discussion about anxiety and depression and the psychological aspects of a concussion, how can we take steps to make sure that we don't fall into that cycle? So one of the things that you want to think about is gaining treatment and getting a medical staff professionals in your corner right away. So after your child experiences that concussion, have they seen a doctor right away? Are you seeing a specialist right away? And if your symptoms aren't resolving in that 7 to 10 day period, are you thinking about getting a comprehensive therapy program for your child? So TheraPlay is a group of, and their family of companies are outpatient centers that look at servicing children between the ages of 0 and 21. So many of our athletes fall into that area. And so when you come to TheraPlay, you can get services that are going to support those physical needs from physical therapy. You may also have some services that are going to look at your cognitive needs, and you'll see that in occupational therapy and speech therapy. But we're going to address all of the other needs that and symptoms that you're going to see within that concussion. Certainly within the evaluation, whether you see physical therapy, occupational therapy, or speech therapy, we're going to get a history of that concussion. Is it your first concussion? Isn't your second concussion? How did it happen? What is your history as a learner? Did you learn to read quickly? Did it take you a long time in first grade to learn to read? What are the aspects of your education that are going to impact recovery? Do you already have an individual learning plan or a 504 agreement because you have attention deficit disorder? And do these things need to be taken into account? Obviously, we're going to do a lot of observation about how you manage your pain and how well you're able to communicate your needs within your concussion. We're going to be asking you about your level of pain. When do you have headaches? What seems to be those activities that increase your headaches most frequently. Physical therapists are going to look at your cervical spine and do an upper quarter screen to make sure that there is no cervical injury that's impacting what's going on as well. We're going to do a neurological screen and look at vision. Vision is one of the number one things that is going to impact return to school as well as return to sport. We're going to look at that vestibular system that I talked about before that's impacting balance and a student athlete's ability to get back on the field. We're going to look at their ability to understand and process information, whether it's their ability to understand expressive language, receptive language, whether they can understand directions that are given to them now. Are they processing the visual information that they're receiving, the auditory information they're receiving, all of that information? How are they impacted by their concussion and their ability to receive that information? We're also going to look at executive functioning skills, and we'll talk about a little bit more today about what those executive functioning skills are. And then we're going to look at outcome measures. What are the goals? Is your goal to return to the sport? Is it the beginning of the sport season? Are we in the middle of the sport season? Is the sport season almost over and you're looking to return to another sport? And what kind of student athlete are you? Are you a senior and you're getting ready to apply for colleges? Or are you a freshman and you're really starting to just have your first experience in honors level courses? So we're going to look at all of those outcomes and see how that's going to impact your concussion. So when we're looking at information processing, some of the things that we need to look at is your ability to have immediate memory for things that just happened, that recent memory of events that have occurred, that temporal orientation, remote memory, spatial orientation, your ability to recall information. Can you use your procedural memory to understand the math problem that the math teacher explained last night? Are you understanding concepts, or do you need to use that procedural memory to be able to recall the information so that you can do your math homework? Is a student able to problem solve, or are they only able to come up with one solution and they keep trying that same solution over and over and it's not working and they're unable to come up with new ways of solving that problem? Are they ability to use their abstract reasoning, or are they really more rigid and less flexible in their thinking and more concrete and not able to use that abstract reasoning? Processing of that auditory information that I mentioned before. Sometimes kids are really struggling with auditory, and it may not just be people's voices, but they may be having trouble processing sounds and difficulty in busy hallways, difficulty in large auditoriums. And then what is their auditory retention of that information? When we talk about executive functioning skills, we want to break it up in two areas. One area is how you function. Can you plan? Can you organize? Do you have time management? That working memory to discuss. And then metacognition. And metacognition is the ability to understand what I know and what I don't know. It's that ability to edit your work or edit your skills. So we all should be able to tell what our strengths are and what our weaknesses. And many times after a concussion, we find that student athletes don't really know what their weaknesses are, and they're struggling to identify them. You see many times in time management, the big thing that parents talk about is he used to be able to get on the bus without me even telling him twice. And now I have to remind him the bus is coming at quarter after, the bus is coming. And taking and getting ready in the morning is so much more difficult. Kids may be saving their homework from the night before for the morning, and then they're not able to get it done. And then other skills and behaviors that we look at within executive functioning are our ability to inhibit some of our thoughts and control our actions. Sometimes after concussion, those inhibition skills are decreased, and you have a great deal of difficulty using those inhibition skills. Dr. Russo talked a little bit about that emotional control, but that can be quite a big problem, and in therapy we're going to be addressing it as well. Sustained attention is that ability to keep your mind focused and filter out extraneous information. And many times after a concussion, maintaining that sustained attention can be more difficult. And so students who've never had a difficulty with attention are now finding it really hard and frustrating. And it adds to some of their anxiety they have about returning to their schoolwork. Task initiation is that ability to sit down, get your homework done, or get the chores done when you come home from school. And many times this initiation is also impacted after concussion. Flexibility is a cognitive skill as well. So we find many times that, you can do plan A or plan B and it really doesn't matter. But after concussion, some kids lose that ability to be flexible, one, because they need to control things in order to manage them. And so they lose that ability to be flexible and have that flexibility and shift from one thought process to another. Flexibility can also impact you in your ability to do algebra, to be able to figure out how to do the problem on the paper and then shift to doing the multiplication within the problem and then going back to the processes of the problem. So that mental flexibility is really an important skill. And that ability to be persistent within the task is also a cognitive skill. So activities that are impacted by our executive functioning skills, our working memory, we may be losing things or misplacing our belongings. They may be putting off tasks until later and then totally forget to do it. When you have a student athlete, they may forget their homework, not know what the homework assignment is, and then have anxiety as a result of that. They may know what the homework is, but not bring home the materials that they need for that homework. When we see emotional control issues, a lot of times we see our students get annoyed if their homework is now hard, especially since it was probably a piece of homework that they would have been able to just sail through before. They easily get upset when things don't go as planned. They're easily frustrated. They seem to have a much shorter fuse than you would have seen before. They start to worry about getting things done. This is a huge problem as the concussion symptoms extend and you're going over a longer period of time. Not only how am I going to get done what I'm assigned currently, but how am I going to make up all the work that I've missed? And this can really create an overall increased anxiety, along with all the other factors that Dr. Russo has already talked about. We talked a little bit about sustained attention, that difficulty and ability to pay attention to what's going on, either on the field or in the classroom. You can be much more easily distracted after concussion. You may run out of energy before you're actually getting the job done or completing your homework, and then just being able to stick to that task until it's done. That task initiation, putting those chores or homework off until that last minute, and like I said before, needing many reminders to get started to do those chores or that homework when in the past your student athlete didn't need those reminders. Planning and organization, they may have trouble planning longer assignments, trouble prioritizing what they have to do and what they should save until later, prioritizing getting classwork done versus homework versus makeup work, and they need to get those reminders to get started with those tasks and to help plan and organize those tasks. You'll see things like their backpack, their locker, their personal space may be more disorganized than usual. So a student who is able to keep their room neat and organized may have a more disheveled look to their bedroom. Can't do anything about those people who already had those disheveled rooms. They may just not be able to find things altogether. And so keeping things like their bedroom, their locker, their book bag tidy so that they can find things can just be a problem. We talked a little bit about time management. Estimating how long a task or a routine will take can be very difficult. If they were used to getting their homework done at night, now they might rush to get through it in the morning, and they're slower to get ready for things. And we talked a little bit about flexibility already, that plan A plus plan B, having trouble thinking of that plan B or what else I could do if that first solution doesn't work. Now they might not check their work for mistakes, even though the stakes seem a little bit higher, and they really have difficulty getting those open-end homework assignments done. Many times we do in therapy, we go through a 5-stage process where we start with looking at the symptoms in isolation and building to working on those symptoms, where we might work on a cognitive task while we're exercising, or a vision task within a cognitive task. So we're going to build within the stages, with stage 5, having that student being ready to go back to school full time, homework done, testing back to normal, and back on that field where they'd like to be. But in the meantime, they may need some recommendations for accommodations in school. And so as part of the therapy process, we're going to help them make accommodations. So they may need preferential seating, to help them minimize distractions, where before they could sit in the back of the room, now they need to sit in the front. Their schedule may be adjusted, and we talk to kids about going to those classes that are hardest to make up. So if your difficult classes, physics, algebra, whatever, are in the middle of the day, maybe going to school at 10 and coming home at 2 initially, and then building that day, or even this morning go in the morning and tomorrow go in the afternoon, so that you're not missing material. We look at reduction in current demands for graded material, reductions for makeup work and homework if needed. We may make recommendations and accommodations for testing modifications. Maybe tests need to be taken in a quiet room. Maybe take-home tests are going to be better. Frequently, especially if you're having auditory concerns, we're going to say no band, chorus, music classes, those classes with extra noise. We're going to allow students to obtain notes from presentations ahead of time, so they don't have to look at whiteboards. They may need to leave class early with a buddy to reduce the confusion and the chance of falling in crowded hallways. We do recommend no smartboard and computer use, and in today's educational system, that's very hard. And so helping them make those accommodations so that they can, limit the smartboard and computer use if possible. When possible, we suggest that you use the concussion symptom monitoring tool. That helps students and teachers understand what the students' symptoms are, because the teachers are actually helping students manage those symptoms and what those symptoms are in a class period. The student should be able to leave the classroom to go to the nurse anytime that's needed, and they may need extended time for projects. And within the therapy process, we may talk about a student's eligibility for a 504 plan, and that is a tool that they can use within their school district to make sure that they have accommodations that are appropriate. Like I said, we're going to use a progression of treatment and intervention guidelines. We're using a 5-stage protocol to get kids back to where they need to be, both academically and on the field. We want to help them develop strategies to manage their cognitive demands so that we can decrease that anxiety and decrease that stress, and really support them through the difficulties that they may be having. And even your therapy team can be the first step to talking through that teacher that doesn't see you as having difficulty right now, and ways to talk about it with that teacher so that they can understand what a student athlete's deficits are at any given moment. So like Dr. Russo said, exercise is a huge piece of this, and we start exercising from the first day that you come into the clinic. Right away in stage 1, we want to try to get you to at least 10 to 15 minutes a day of exercise, and by stage 5, we're working in a 50 out of 60 minutes of that therapy session, while you're really working on getting your cardio and aerobic exercise in, as well as a home program, so that you're completing exercises at home every day when you don't have therapy. And we want to provide within that whole 5-stage protocol the support for your academic demands. When we're preparing for discharge, we would like a student to be back to school full-time, handling a full academic rigors, including test taking without accommodations, and their ability to be making up that missed work. Once a student athlete gets back on the field, I had 3 student athletes, and they left my house at 6:30 in the morning, and they frequently didn't get home till 10 o'clock at night, and then had 3 or 4 hours of homework on top of that if they were, excelling students. And so Dr. Russo had talked about sleep and, the ability to get the amount of sleep that you need. So we need to make sure that a student is really ready to handle those academic rigors before we put them back on the field full time. We want to ensure that they're getting the rest, that they're building social interactions back, and that rest, social, and school balance starts to occur. We want to make sure that students are meeting any baseline impact testing scores that have been taken by the school district. We want them to remain symptom-free throughout stage 5 treatment. And when we talk about symptom-free, we're really talking about no headaches, no dizziness, no concerns whatsoever in all of the aspects of what they're doing. And when we're preparing for discharge, we want to make sure that the parents or caregivers agree that their student athlete is really fulfilling their previous activity pattern demands. That's extremely important. So what can you do as a parent or a student athlete if you're concerned that your child might have a concussion? The first thing that you really should do is call your family physician or your pediatrician and start to discuss them. And if they would like to reach out to us, we can help them make the referrals to Theraplay in southeastern Pennsylvania and Delaware, the Children's Therapy Center in Northern Virginia and the DC metro area, and Positive Steps out in western Pennsylvania. You can always contact us with any questions that you have through Facebook and on our website. And remember that early intervention and communication between caregivers, therapists, medical professionals, teachers, and coaches is crucial to returning your student athlete to their baseline function and their maximum potential. So I know we have a couple of questions that might be out there. I think I'd like to just start with Dr. Russo. Dr. Russo, when do you see that you're getting referrals to Springfield Psychological or for a psychologist? Where in the process of return to school and sport are you starting to see kids?
Sure. Well, so this is one of those ones where it's really dependent on your state and the way your state's concussion laws. And again, I'm speaking to this from a sports concussion perspective. In Pennsylvania, the state law puts me as a psychologist on equal footing as an MD or a DO in the sense that I can make return to play decisions and I can make return to learn decisions regardless of whether they've seen a physician or not. So Pennsylvania is a relatively unique state. We have UPMC and the UPMC concussion program here in the same state, probably to thank for some of that. But the way that the concussion law in Pennsylvania is, and I've worked in Florida and I've worked in other states, and so just across the river in New Jersey, it's a completely different concussion law. So I think people just need to understand what their concussion laws are and what they say. If you think about like the neurocognitive tests that go into some of the concussion management process, those are psychological tests, neuropsychological tests, and so the way a psychologist or a neuropsychologist interprets those tests is maybe a little different than the way a physician would interpret it. Baseline testing, post-injury testing. Certainly the way I interpret some of those tests is different than do they just pass their baseline. You know, I'm looking for patterns for ocular, vestibular issues. I'm looking for memory patterns and things like that. So I'm not just looking at the test of whether they look at, whether they pass their baseline. So I'll see athletes or I'll see concussions, within 48 hours after their injury. A lot of times they'll have seen their primary care doctor or seen a pediatrician. I like working in concert with other medical professionals. I don't know how you do this kind of work without having a team around you. So I've worked in, when I had my concussion program in Florida, it was a true interdisciplinary program where people would come through, 24, 48 hours after their injury, see me, and also see a physician in the same visit. And so it really comes down to what your concussion laws say and what are the experts in the area. And do you have a physician in the area that really understands concussion? Great. If your pediatrician or if your primary care doctor doesn't know a lot about concussion, then I think your message is absolutely right on. The earlier you can get to a specialist, the better off you are. But to me, it's just really dependent on your state laws and what your state laws around sports return say.
Okay, great. So we have a question here, I think from a nurse, and I'll let you field this first, Dr. Russo. How can
Sure.
you tease out kids that are milking it?
Right. Well, it's hard. I think the more objective testing you get in the process, the easier it is to do that. And so, for example, like my evaluations with an individual after a concussion, they last sometimes over 2 hours, where I'm getting a thorough history, I'm getting an understanding of their academic background. Does their baseline testing match their academic background? If it doesn't, then there's your first red flag. If you have an athlete that is, or an individual that is, quote unquote, sandbagging their baseline, then there's your first indicator that this is an athlete that really is trying to kind of circumvent the system. So then the other part of it is that I look at symptom scores before and after they take their test. Sometimes you'll see a huge difference in the way that they endorse symptoms before and after they take a cognitive exam. There's some indicators there that there's a psychological issue going on, but it's really hard objectively. Like, I'll do a vestibular ocular screen. It's really hard to control your eyes voluntarily if you're doing a vestibular ocular screen. It's really hard. I do balance screenings. It's hard to really control your balance or to sandbag your balance. So I think the more objective testing you get into the process, my personal opinion is that we've kind of regressed a little bit with some of these concussion evaluations, and that, 5, 6, maybe even 10 years ago, everybody was doing comprehensive evaluations, and now we seem to have kind of gone backwards a little bit, where people are just using one test, where people are not including things like balance and vestibular ocular screens in their evaluations. So to me, the answer is objective testing, and a variety of objective testing in different areas. That gives you a little bit more firm footing when you start making return to learn and return to play decisions, because it really should match up with academic history and academic background.
Right. And I think one of the other things that we see, like you said, it's very hard to, show that you have ocular motor deficits when you don't have them. That's very difficult to show, as well as I think in the therapy clinic, we're really pushing kids to that next level all the time. And so sometimes when we see that they're not participating in home programs, we're going to question parents. We're going to get other professionals involved to figure out why aren't they participating? What's happening? Do they need psychological services to get them back where they need to be? And sometimes you see kids get to that stage 5, and I think some of the hardest kids to get back and really be able to tell whether they're back to their previous level is kids who had learning disabilities prior to their concussion. Where is the learning disability and where is the concussion? And that's really looking at what are their previous test scores and how are things compared now. And, talking to the parents about how much preparation did they do for a test before? How much preparation are they doing now? And then doing some of that preparation in the therapy clinic to support them within the academic setting as well, to see if we can tease out whether it's a learning disability or whether these are truly concussion symptoms, and help.
The other thing I would throw in there is if their symptom report doesn't match consistently with what we know about concussion. If they're talking about a headache, and let's say we have a person with an ocular problem that is talking about pressure headaches and eyes feeling tired and napping, what I call unintentional napping. Their eyes get tired, they rest their eyes and they accidentally fall asleep. That's a pretty standard kind of ocular presentation. When you start seeing people that, when they're cleared to do things that they're not doing, so you're allowed to go for a walk, you're allowed to get on the exercise bike, you're allowed to do some non-contact cardiovascular activity, and you're not doing it, that's a problem. That's a red flag. When you're encouraged to go to half days and bump up to full days, but then you don't go to that full day and you just stay at the half day, those are other red flags. And so when people are cleared to do things and they're not doing them, that's a concern. The other part of it is that you do have to have some consistency in presentation, and that's why seeing people for second evaluations and follow-up visits is really important. If one day they're telling me they have a headache and then the next day I see them, they never even mention headache, all right, then I start questioning things and I start wondering about their motivations.
And that's the positive thing about occupational therapists, physical therapists, is we're generally seeing kids 2 to 3 times a week. And so we can really get that presentation across a week and what it looks like. And if they have headaches for other reasons, if they're a child who had menstrual headaches, or they're a child who had migraine headaches due to stress. We can really look at what is the schedule of headaches, and is it truly a schedule that matches another group of symptoms, or is it a headache schedule that is matching the concussions symptomology? And so we can really tease that out, and this is where it's super important for everybody who's involved with that student, the trainer, the psychologist, the pediatrician, the family doctor, the specialist, the therapist, are constantly in communication with each other, the guidance counselor, the parents,
Exactly.
so that we can make sure that we are moving that student forward, and that we don't really have kids that are milking it, because everybody's in communication on their treatment team. Okay. And I think we have no more questions at this point. I want to thank everybody who joined us today, and thank Dr. Russo for his expertise. We're very lucky to have him today. So thank you for joining us, and hopefully we'll talk to you again in a future webinar.
Great.
Oh, and one other thing I think we wanted to add is that if some of the kids out there have executive functioning issues prior to their concussion, that our speech team and our occupational therapy team can also work with those skills to manage them as part of a learning disability, or as part of a diagnosis with ADHD or ADD. So a lot of times we're already used to working with those skills with kids who already have executive functioning, and we can determine whether those are skills that have now been exacerbated due to the concussion, or whether these were some premorbid skills that we can talk to you about gaining strategies for. So thank you again, everybody. Take care.